Assalamu alaikum. My name is Dr. Zartash Rehan. I am a trainee in obstetrics and gynecology, and I run a playgroup called Bismillah Babies, which I started in my second maternity leave. And my real passion is about empowering women with knowledge in pregnancy and after birth so that they are able to get the best experience possible. And that's really one of the reasons why I started Bismillah Babies. I'll be talking today about wellness in pregnancy and after birth, mainly focusing on physical wellness, touching on the mental wellness, but that's a whole topic in itself. So I'll start with that, inshallah. If you have any questions throughout the presentation, just pop them in the chat box and we will address them at the end. So the aim of what I'm delivering today is to talk about cultural practices. So we all come from a diversity of different ethnic backgrounds and different cultural practices, some of which are beneficial and some of which are a hindrance in terms of actual well-being, looking after our well-being during pregnancy and after. And so I'm here to sort of hopefully talk about some of the myths and bust some of the myths really around what we should be doing using scientific evidence and also Islamic guidance. So to start off, the first myth is that pregnant women should rest as much as possible and avoid exercise completely. So this is sort of across many cultures, this is the advice that's given. But actually, we know from all of the science, from women who have exercised in pregnancy, myself included, will tell you that there are so many benefits of exercising in pregnancy. And this doesn't mean, going for a run. This can mean just gentle movement, walking, doing a bit of stretching or yoga, prenatal Pilates, just anything really that keeps your body moving. And the benefits of this include reduce risks of gestational diabetes, reduce risk of high blood pressure, which Dr. Como is going to talk about in the next presentation, better sleep, reduce back pain, better mental well-being, and reduce rates of postnatal depression, an easier recovery after birth. And actually, it has not just for the mum, but it has amazing benefits for the baby in terms of the baby's neurodevelopment, the baby's reduced risk of chronic diseases and obesity later on in life. So all of this helps not just the pregnant mum, but the baby as well before they're born. So the next myth is you shouldn't do any lifting in pregnancy. And although, we should avoid lifting really huge weights, there are so many pregnancy safe exercises that we can do. So walking is one of the best forms of exercise in both pregnancy and after giving birth. It improves circulation, helps with blood sugar control, supports mental health, and makes you less stiff and improves your energy levels. And there are, you are able to lift weights in an appropriate way. So you can do strength training during pregnancy, and that really also helps building stronger muscles for carrying children. After you give birth, you will have a newborn to hold and maybe other toddlers and other children. So it helps to strengthen the muscles for carrying children. It reduces back pain and improves posture and also improves pelvic stability because pelvic girdle pain is quite a big thing in pregnancy that many women experience. So helping to strengthen those muscles through exercise helps to reduce that. Swimming is really beneficial because the buoyancy of the water can alleviate joint pain. It helps with pelvic pain and sciatica because the water helps to support your body's weight. And then things like prenatal yoga or Pilates help with help with building that connection between breathing and relaxation and the pelvic floor. And all of those things are really important for both pregnancy, birth, and after birth. The one thing to bear in mind whilst exercising during pregnancy is a simple talk test. So you might be more breathless during pregnancy when you're doing any form of exercise, but you should be able to continue talking and maintaining a conversation. And if you're able to do that, you're able to carry on. And then after birth, what are we told? We're told, oh, do lots of sit-ups, strengthen your tummy, you need to bounce back. But actually, a lot of abdominal exercises, especially done very early on, can worsen the separation of the abdominal muscles. So what happens in pregnancy is that your abs or abdominal muscles will naturally separate due to the growing baby, to allow room for the growing baby. And after birth, they will slowly come back together. But this process can take weeks, sometimes months, sometimes longer than that. And so to allow time for that to heal, you shouldn't rush to do things that, things like sit-ups or crunches or exercises that sort of cause doming that you're able to see of the tummy as you're doing them. So instead, things that you can do is roll onto your side to be able to get up and do gentle exercises to deeply engage those core muscles and rebuild the strength very gradually. So you're not going 6 months, at the 6 week mark after the GP checkup, you're not starting to do crunches and sit-ups. You introduce those exercises very gradually and slowly. And the other thing after birth is leaking urine. So some people say, oh yeah, leaking urine is normal, just live with it. And although bladder leakage is common in the first few weeks after birth, because the muscles and everything have been stretched, there's hormonal changes, it's not something that you should have to live with. And if it continues to persist, when you have your 6 week checkup with your GP after giving birth, then that's something you should raise with them. And you can also see a postnatal physiotherapist that can help to assess the degree of weakness of the pelvic floor and can refer you doctors, or they can then refer you onwards to the appropriate specialist if you need to. So got an important slide here about pelvic floor exercise. So this is not just, it's very, very important during pregnancy and after birth, but it's important for everyone. So everyone who has joined this webinar, we are all women. We should all be doing pelvic floor exercises. And we get told this, but yet we don't know how to do them. And people clench and put in too much tension and they're not actually relaxing. So you're not doing the exercises properly. So I, at the expense of ruining blueberries for you for the rest of your life, have got blueberries to explain how to do this. So this is the blueberry method to explain how to do your pelvic floor exercises. So firstly, the first step is to get comfortable. So whether you are going to lay on your back with your knees bent and your feet flat, whether that's on your bed, on a sofa, somewhere comfortable, or you can sit comfortably. And then the second step is to relax. So the focus is on relaxing your belly, relaxing your jaw, and relaxing everything inside. So relaxing your jaw. Actually, your jaw has a connection with your pelvic floor. So relaxing your jaw helps to give you a relaxed pelvic floor. So the way to do this is to take a deep breath in, sort of a belly expanding breath all the way in. And then when you're exhaling, you're imagining a blueberry and you're imagining your vagina trying to pick up a blueberry and drawing it upwards and inwards. So it should feel like a light tightening sensation pulling in. You shouldn't be clenching, you shouldn't be pulling everything in, just gently lifting up a blueberry as you're exhaling in. And then when you inhale, you're bringing the blueberry down completely. So you can do that in your own time. You can do that for a certain number of reps. Try to do it as sort of 10 repetitions where you can do it slowly, and then you can do 10 repetitions quite quickly. But the focus isn't just on the squeezing and holding, the focus is on the relaxation part. So unless you're able to relax, you won't be able to do this exercise properly. So the steps again, get comfortable, either lay back or sit comfortably, relax, relax your jaw, relax your pelvic floor, take that big, deep, nourishing breath into your body, and then exhale. As you exhale, imagine pulling up the blueberry, hold, and then as you inhale, drop the blueberry gently. So those are the steps. Hopefully, I haven't put you off blueberries too much, and hopefully that's beneficial in sort of visualizing how to do your pelvic floor exercises. And as I said, these are very important in pregnancy and after birth, but are are important regardless. So our young girls to be taught how to do these because really building that muscle memory and building that is helpful for us all as women. And then we come on to the next myth, which is after birth, you should stay in bed for 40 days. We've all heard this. And although rest is extremely important and healing is extremely important, having support in that first 40 days, in that first few months after giving birth is very, very crucial. But staying in bed isn't recommended for most people. Gentle movement after birth can help to reduce your risk of blood clots, can help to improve your mood, help with the bowel function and get things going because quite often with the hormonal changes and everything else, you can get quite constipated in birth and after. And so this helps, movement will help with that. It can help with your recovery after birth and also circulation and healing. So we'll talk about this in the next slide as well. So if you have stitches or tear, we're often told don't move because it will open them. And people are scared and people just want to sit down in one place. But actually, gentle movement helps to improve blood flow and help the blood flow helps with healing. And so, for example, if you have had a tear or an episiotomy or something down below, sitting for prolonged periods can actually increase the swelling because all the blood and everything starts to collect. And then that can become more painful. You can feel more stiff. So the more that you're able to change positions, go for short walks, or use cushions. For example, you can get those donut ring type cushions to sit on if you have had episiotomy or tears and things that have been repaired. They can really help in terms of comfort. And then after a C-section, again, a lot of cultures say you should have bed rest. Well, a C-section is major abdominal surgery, and women definitely need support and time to recover slowly. And one of the big pieces of advice that's given medically is to avoid heavy lifting initially. But you are able to still move gently after the surgery. And actually, this is really important in terms of reducing risk of blood clots. So any surgery, especially abdominal surgery, will increase the risk of getting a blood clot in your leg or your lungs. And walking and movement after helps to reduce that. It improves circulation, it improves and reduces gas pain, and that some people say is worse than the C-section scar pain. So, it really helps with that and with the bowel recovery and with healing as well. And then I wanted to just briefly talk about the Islamic perspective on wellness and nourishment and movement and go back to the Quran. So what is said in Surah Maryam? So in Surah Maryam, movement during labor was encouraged. So Miriam was told whilst she was in labor to shake the trunk of the palm tree. And what does this tell us? This tells us, shaking the trunk, she had to be upright and, probably leaning forwards. And this goes alongside with a lot of what we have, the evidence that we're now collecting about movement during labor helping and about positions that are upright, forwards, and open. So the way to remember that is UFO, upright, forwards, and open. So those positions help during labor. And active labor was encouraged for her, and effort was encouraged. She wasn't told to completely remain still and lay on her back, which is what we see a lot of women do. So even when you're in labor, being active really helps. Eating dates. So Miriam was told to eat dates, and evidence now shows that when you eat dates in the last part of your pregnancy, they help to ripen the cervix for labor, which then results in shorter labors. And also, dates provide energy in labor, they support iron intake and help to provide fiber and minerals that you need. So, dates are amazing, whether you can eat them just as they are or make date balls and you can take them into labor with you, have them as a postpartum snack. So, dates are really beneficial. And then drink water. Miriam was told to drink water as well. And we know that hydration is extremely important for circulation, for breastfeeding, healing, and to prevent constipation. So dates, nourishment, water, and this focus on nourishment is picked up on a lot of our cultural traditions across many different cultures, and many postpartum foods that are made for women are deeply nourishing. For example, panjiri, which is used in South Asian cultures, can provide healthy fats, nuts, and seeds, and the calories that women need for healing and for breastfeeding. So, as I said, I've mainly focused today's talk on the physical well-being in pregnancy. However, mental well-being is obviously very, very important. And mental health after pregnancy is just as important because you have a real shift in your identity, a change in your identity. You're now, especially as a first-time mum, things can really change drastically from, yourself as a couple and now having to look after a baby. You might feel very lonely, up all night feeding baby, and having community support can really help to reduce that loneliness, normalize struggles, and help to have that community that can give you confidence and support your recovery. And that's one of the things that we try to do with Bismillah Babies. It's a playgroup that we run every Friday in the Rabbania Islamic Cultural Center. And I can put more details about that in the chat for anyone interested. But just as, a lot of people think, oh, I'll go to a playgroup when the baby's able to sit or when they're a little bit bigger. But actually, playgroups, I personally think are less for the children and initially more for mums. So even as soon as you're able to get up and about and you feel that you're able to get out of the house, I think playgroups or going to spaces where you're able to connect with other women in a similar position to you can just be so comforting to hear you weren't the only one up in the night feeding the baby, and you're not the only one going through struggles like leaking or anything else. It's just that mutual connection that you can form that helps with the mental well-being aspect, which is really important and very overlooked. So thank you everyone for listening, and welcome to hearing any questions.